When you find out your dog has cancer, you may think, I'm not going to go the traditional route. I am going to go the total homeopathic route for my dog's cancer. And I wanted to ask both of you veterinarians what your thoughts are about going the homeopathic route.
It's interesting when we look at the different treatments that we have available. And, we should also differentiate between homeopathic versus holistic or alternative, because homeopathic has to do with using very minute amounts of substances in the body to try to create a certain effect. And alternative or holistic usually refers to the branch of medicine that is non-conventional in the area of cancer. The conventional stuff is surgery, chemotherapy, and radiation. And in the holistic compartment, we have diet, supplements, acupuncture, mind-body, and touch therapies, things of this nature. When we look at homeopathy specifically, which is, again, very, very small amounts of substances in the body to elicit a certain effect, there's not that much evidence that we have to support the use of homeopathy. There are a few studies out there with brain tumors, and not really all that much else. And if you look at all of the literature, whether it's from Europe, Germany, where homeopathy came from, or Asia, or the United States, there's very little good information there. So all we have to rely on is people's opinions and experiences, what they call anecdotes, individual case studies. And the problem is that when we're creating a full spectrum plan for a dog, we want to make sure that we're using something that's high yield. And we want to therefore pick things where we know we're going to get a good benefit or a high odds ratio of a good benefit. And my opinion on homeopathy is that homeopathy is not one of the top therapies that we have to use for canine cancer, although it can help a little bit potentially in certain cases.
And you mentioned full spectrum. There's a whole video in the series about that. But just briefly, what is your full spectrum approach, and how does that differentiate itself from homeopathy or holistic medicine or alternative vet medicine?
One of the downsides that's happening in the holistic medicine division, the area right now, is that there are some veterinarians who are alternative who are willy-nilly, indiscriminately grabbing a whole bunch of different things to use. And they're not looking at necessarily efficacy, and they're not looking necessarily at safety. And both of those things are very, very specific and important to us because there's a whole slew of quote-unquote natural or holistic things out there that we can choose from. And if we're not selective, what we end up doing is picking 10 or 15 or 25 different treatments to use for a dog, and we may not be benefiting the dog, and in some cases we may even be hurting our loved family member.
Dr. Ettinger, your thoughts?
I think Dr. Dressler brings up a great point, and I think that's, the frustration of some of the conventional oncologists out there, and I consider myself to be, more open-minded, and I think it's important to be integrative, and I think people should realize they don't have to just pick conventional or just pick holistic. And it's great to find an integrative approach where maybe you're going to do a little of each, but not just do everything. And I think that, you want to talk to an expert who can help you guide you, through all of the holistic treatments or all of the conventional treatments, and then pick what, is really best. And you don't have to pick one or the other. And I think that's where a lot of people feel torn, is that they don't think they can do both. And I think you can do a little bit of both very safely. Again, you just probably going to have to bring two experts together and work as a team.
That's sort of what the Dog Cancer Survival Guide is all about, where you're just talking about the best approaches regardless of from which field of veterinary medicine it came from. Dr. Dressler, thank you so much. Dr. Ettinger, thank you both for being with us.
Thank you.